patients can expect some changes in the look and feel of their breast after a lumpectomy. After a lumpectomy, you can expect some changes to the way your breast looks and feels. After the surgery, immediately you'll see an incision where your surgeon has done the lumpectomy, and that usually just looks like a red line on the breast. Most surgeons will use stitches that dissolve under the surface of the skin, so you really shouldn't need to expect stitches to be removed or the look of stitches on your skin. When your surgeon says it's okay to take the bandages off, you'll notice that there is some numbness over the incision itself. Usually that numbness is right around the area of the incision. It doesn't necessarily encompass the entire breast. But if your incision is right next to the nipple, you can have some numbness of the nipple as well, and that's usually temporary and comes back over time. You may also notice some swelling at the site where you had the lumpectomy and amongst the entire breast itself. Swelling can be noticed at the lumpectomy site because of fluid, and an accumulation of fluid is something we call a seroma. Sometimes it can feel kind of firm, almost like a lump in the breast where the lumpectomy was done, but a bit softer, and that fluid will reabsorb over time, and it can take some time before it reabsorbs, but it will. And the swelling in the rest of your breast can be due to congestion from changes in the lymphatic flow and blood flow, but that'll go back to normal over time as well. In the long run, though, patients after a lumpectomy will often proceed to getting radiation. And it is important to note that radiation changes can occur over a period of years even, and that can affect the way the breast looks after a lumpectomy with radiation too. The number one thing that women will report after a lumpectomy during the time that they're receiving radiation is a redness of the skin. It usually just looks like a sunburn, and most of the time you can use some lotions or salves to make that redness go away or ease the discomfort. And then once your radiation therapy is done, over the course of time, even though the breast is preserved, it may show some signs of contraction, meaning a volume loss up to about 10% in that breast after you've had a lumpectomy with radiation. So even though most women do achieve excellent symmetry between both sides, it's important to know that there are some changes to your breast that may change the overall shape and appearance that can show up after a more extended period of time.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.